MDMA, an animated presentation by Abigail Farley. The formal name of MDMA is 3,4-methylene-dioxymethamphetamine. Since this is a mouthful, you will most likely hear friends or that guy that lives down the hall referring to it as Molly, ecstasy, XTC, beans, or atoms. MDMA was created by a German pharmaceutical company in 1912 to create medications that control bleeding. It became widely used by psychiatrists in the 1970s and 80s with the belief that it enhanced communication in patient sessions and allowed patients to achieve insights about their problems. MDMA is a synthetic drug that is similar to both stimulants and hallucinogens. Chemically, it is made up of carbon, hydrogen, nitrogen, and oxygen. It is taken to achieve a high, increasing happiness, engagement, sensory perception, and mental stimulation, typically categorized as a party drug. Ecstasy is typically taken orally as a tablet or capsule. Some is absorbed from the stomach, but most is absorbed from the small intestine, reaching peak plasma concentration around 2 hours after administration. It often depot binds to tissues, leading to a decreased bioavailability. MDMA is mainly metabolized in the liver by the enzyme CYP2D6, which is a part of the CYP450 enzyme family that is chiefly responsible for metabolizing psychoactive drugs. It has a half-life of 8 hours, and it takes about 5 half-lives, aka 40 hours, for 95% to be cleared from the body. MDMA is filtered through the kidneys and excreted through urine, relatively unchanged and only broken down into its key metabolites. Pharmacokinetically, MDMA is often unwillingly administered, often being slipped into drinks. Additionally, some of the various enzymes in charge of metabolizing it can become saturated with high doses, leading to unusually high concentrations in the bloodstream and ultimately the brain. MDMA works on the serotogenic system, serotonin being a neurotransmitter that plays a role in mood, sleep, appetite, and memory. It is involved in disorders such as depression, schizophrenia, eating disorders, and OCD. Serotonin receptors are metabotropic G-coupled protein receptors. When binding occurs, the G protein makes various changes to cell functioning. MDMA in its pure form is an indirect serotonin agonist, leading to copious amounts of serotonin being released into the synaptic cleft. It acts on the serotonin transporter, which is responsible for mediating extracellular serotonin concentrations. MDMA enters the nerve terminal and increases the amount of serotonin that is available to be released. Lastly, MDMA binds to serotonin receptors and blocks its reuptake, leading to increased concentrations remaining in the brain synapses. MDMA also enhances the release of dopamine and noradrenaline, inhibiting monoamine reuptake and slowing its metabolism by inhibiting monoamine oxidase, acting similarly to antidepressants. MDMA produces the short-term effects of euphoria, increased closeness to others, loss of appetite, and hallucinations due to the increased levels of serotonin. Specifically regarding noradrenaline and excitation of the sympathetic nervous system, elevated blood pressure, seizures, muscle tension, and hypothermia can occur. Long-term effects are a result of depletion of serotonin in the brain due to neuronal damage. These are chiefly cognitive and include the inability to pay attention, memory loss, confusion, and decreased inhibition of impulsiveness and aggression because lower serotonin levels result in weaker communication between the limbic system and the frontal lobe. Studies show acute tolerance through the downregulation of serotonin receptors as an adaptive response, and pharmacodynamic tolerance can be seen due to depleted serotonin levels, resulting in the need for higher dosages to achieve the same subjective euphoria. There is limited research on behavioral or metabolic tolerance. Although ecstasy is not considered addictive, rats have been observed self-administering it, and it has been seen to activate the dopamine reward pathway. Risk factors for using ecstasy include being an attender of raves or concerts. MDMA leads to increased serotonin but damages the neurons producing it, leading to lower production overall and withdrawal symptoms of depression, depersonalization, and mood swings when MDMA is no longer compensating for this decrease. These withdrawal symptoms can lead a person to physically depend on ecstasy to be happy, feel emotion, or maintain a stable mood. Thanks for watching, and don't do drugs, kids.